Funding for this edition of State of Affairs with Steve Adubato has been provided by Delta Dental of New Jersey. Everyone deserves a healthy smile. The Russell Berry Foundation, making a difference. The Adler Aphasia Center. Robert Wood Johnson Foundation, working for a healthier, more equitable New Jersey. Community Food Bank of New Jersey. Summit Health, a provider of primary, specialty, and urgent care. The Northward Center, New Jersey's clean energy program, lighting the way to a clean energy future. And by Johnson & Johnson. Promotional support provided by the New Jersey Business and Industry Association. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
Hi, everyone. I'm Steve Adubato. We kick off this program with Dr. Elizabeth Clemente, who is the chair of the Department of Dentistry at Morristown Medical Center. Doctor, so good to have you with us.
Thank you very much. It's a pleasure to be here.
You got it. Let's talk about dental health, which is a lot more than simply dealing with cavities and cleaning your teeth. Oral health, please.
So the mouth is the doorway to the body, and whatever goes in or is infected, et cetera, goes out. So it's very important that the mouth, and it's critical in digestion and a number of other bodily functions. So it's important that your mouth is clean and functional and free of decay and infection.
So let's do this. One of the biggest reasons we have you on is because you're very focused in the work you're doing with the Morristown Medical Center Dental Clinic in dealing with the fact that a disproportionate number, just way too many people who are struggling financially, particularly in communities of color, are not getting the dental/oral health that they need. This is an issue of health equity, is it not?
Yes, it is, absolutely.
Talk about that.
So what most people don't realize is that this clinic has been in existence since 1960. A group of volunteer dentists would come in and take care of emergent patients who had dental problems. Since then, our first resident was graduated in 1972. So this residency program has been here 50 years. So it's not like a new thing for this community. What happens is my staff of approximately 120 docs pay dues to the hospital. And remember, most dentists do not make a living in a hospital. They make it in their office. So they pay dues to belong on staff to come here on a volunteer basis to help me teach these residents. And
why do they do it?
Because there's a need, and dentists run their own ORs and everything else. So someone needs to take care of the underserved, and this is a very convenient way to do it in terms of we can take care of their dental health. We often evaluate, we always evaluate the physical health. So we turn them over to the physicians in the hospital if we catch something, i.e. high blood pressure, uncontrolled diabetes, those sorts of things. So it's a great place to handle this population, because we have the ability to solve their other problems also.
Doctor, talk about, the numbers are striking to me, the number of patients you deal with every year, the number of procedures performed every year, please.
Well, we work 5 days a week. I start off with brand new residents every July 1st. We have a lot of backup, as I said. Sometimes we have 4 docs in here for the 4 residents who are here. So coming into the 4 volunteer docs here to come in and help out. They start off very slowly, but in the end, we do every procedure that any other general dentist does. And they're up to speed. Actually, about now, they're getting up to speed they could go out and practice, but they choose to come here because of the expanded training that we offer them.
Let's do this. You talked about some of the I shouldn't say larger, but some of the significant health issues, challenges, and problems that are identified through an oral checkup. Could you go through some of them? Because I'm often struck by, I thought I knew, And then I realized that there were some health issues, medical issues that are potentially identified that I didn't even realize. Please.
So, for example, bleeding gums is an indication of an infection generally, but it could be a blood disorder or dyscrasia. Rampant decay, there is issues with diet possibly, but also with metabolism. They could be diabetic, and that's an issue for diabetics. They decay very quickly. The sugar is in their saliva, and it's rinsing their teeth on a regular basis. So those are two of the big ones. But you must remember that we also take blood pressure, and we catch blood pressure problems on a regular basis.
Cardiac issues? Yes,
and we do all of a pre-screen that we can do physically as a dentist, so that patients, we know what's going on with them medically. Very often this patient population is not receiving, consistent medical care. So people will come in and say, I stopped, they're weaving down the aisle, and I say, did you take your insulin? Well, I haven't been taking it because I ran out of it and I haven't been able to refill it, that sort of thing. So those are the kinds of things that we catch medically and refer back down to the ED on a regular basis.
Doctor, what happens if, I'm sorry for interrupting, what happens if those potential problems, medical problems, are not identified through an oral dental checkup? I know it's case by case, but those situations often only get worse.
That's right. And then we end up with the patient who walks in and goes down on us, which does happen. And then, then we're in a really emergent situation because it wasn't picked up ahead of time. We also try to encourage these patients to stay on their medication, and we try to help them find ways to get their medication so that they can keep going keep everything running the way it's supposed to be.
Let me also say this, that Morristown Medical Center, part of Atlantic Health, one of the healthcare organizations that support our healthcare programming at the Caucus Educational Corporation. Let me ask you this, Doctor. The world of dentistry changed dramatically over many years. The biggest impact of COVID on dentistry has been?
Well, initially, from a private practice standpoint, people had to limit the number of people they could see, patients they could see during a day, because you couldn't, you had to wipe, it involved running strictly like an OR, where you had to reset and reboot, and you couldn't have a certain number of people in a waiting room or in a small space. So it cut down on the number of patients private practice practitioners were allowed to see. Fortunately for us, we were fitted with a negative pressure room to help cut down on the spread of any potential infection. We also were fitted, we've always worn masks, as you know, as a dentist always wears a mask, glasses, and a gown. So we were able to continue our sort of hyped OR procedure and protocol. And because of the hospital, they had the equipment, they had everything we needed, and they provided it to us so we continue to see patients and take care of them.
Great. Dr. Elizabeth Clemente, I want to thank you so much for joining us. Important information.
Thank you.
All the best. Stay with us. We'll be right back.
Hundreds of thousands of people in New Jersey face hunger.
Now, more than ever.
Together with our 800-plus agency partners.
Now, more than ever.
The Community Food Bank of New Jersey is fighting hunger.
Now, more than ever.
You can help our hungry neighbors by going to cfbnj.org. Join us.
New Jersey is home to the best public schools in the nation, and that didn't happen by accident. It's the result of parents, educators, and communities working together year after year to give our students a world-class education, no matter the challenge. Because parents and educators know that with a shared commitment to our public schools, our children can learn, grow, and thrive. And together, we can keep New Jersey's public schools the best in the nation.
Hey everyone, this is Steve Adubato. More importantly, this is Sean Spiller, who is the president of the New Jersey Education Association, also the mayor of my hometown. Not originally, because I'm originally from Newark, but now it's Montclair where you're the mayor. Good to see you, Mr. President.
Great to see you always.
We are here just hanging out at the NJEA Convention.
Yeah.
What's it feel like to be here?
It's great. It's great to be back and, building on as we come out of the pandemic, certainly what we saw last year, but even more, the energy, coming back, the people, it's great to see. We know it's the largest professional development opportunity probably in the world for educators, and this is a great space to be in, and we're seeing the excitement. So I'm going to talk about school violence in just a moment. Right out of the box, I want to talk about the teacher shortage. Task Force just announced, as we're doing this in November of 2022, this will be relevant for a long time afterwards. The governor has announced his task force to look at teacher shortage. It's a national issue, but how does it affect us in New Jersey, A, and B, what needs to be done? I'll work backwards. The answer is we need to do everything. It's a huge issue. We've seen for the last decade now, the number of educators going through the teacher prep programs in New Jersey has been declining. Another big problem we've seen, though, a lot of people talk about this in the context of the pandemic, thinking there's so many more people retiring. Not really. It's people leaving the career mid-profession. So mid. Because? Well, that's the issue, right? So we've got to look at why is it that people aren't staying in? And when we started to look at some of that data and we polled our members, we've asked what's going on, the inundation with paperwork and just things that keep you busy but don't have that relationship to your student success. The stresses that everyone's facing. We're short-staffed, so that means you're missing your prep period, you're missing your lunch period to go cover a class, to try and fill in for a colleague. That adds more stress when you can't prepare for your classes. You're being asked to cover more and more, right? So there's that added layer to it. You're also talking about right now a climate where you go to a board meeting. Let's talk about the political tough situation. Politics has always been, politics has always been a part, but the level of politics, the level of intensity, the level of anger at school board meetings and directed toward public education has never been what it is, whether it's about critical race theory or the perception of what it is versus what it is. Health/sex education courses, what it is and what the perception of what it is. What does that do to a teacher? Yeah, well, we're seeing it. You leave the profession for many, and unfortunately, we see the stressors that those who still remain face. It's a challenge. No one likes the acrimony you see. We all are passionate about our kids, so that's a given. And we all want parents involved in our children's education. That's top priority. But, coming to a meeting, making accusations, wild accusations, attacking educators for teaching the curriculum. That's attacking them personally sometimes? Yeah, often personally. I think it's a space where we've got to get away from to say we all want what's best for kids here. Let's come at it from that perspective and see how we can work together on issues. But if we don't change the climate, the very educators who've been doing a great job helping us have the #1 schools in the nation are going to be leaving, and that's a big problem for all of us. Let me ask you this. In other states, I think in Florida, possibly in Texas as well, there's an effort to change the process of becoming a teacher, the certification process. Yes. Should it be easier to become a public school teacher in the state of New Jersey? And if so, what would that mean? Yeah, the answer is yes and no. Yes, if there are barriers or obstacles that slow people down to get in who should be getting in, meaning right now we've got student teaching that goes a year long. You look at any internship or anything to onboard into a profession, no one has to work for a year, not get paid. Let me repeat that, work for a year. They don't get paid, right? Do that for a year and then come on in. That's a barrier for a lot of people. How do you do that, right? No other thing has these exams after exams after exams. After you've passed a college preparation program, after you've got, success in high school and beyond, now you've got all these other tests, which all cost money, that you've got to pass to come into the profession, right? These are barriers that, yes, we should eliminate. We still at the state level have residency requirements. You can't become an educator if you don't live in New Jersey, right? We're trying to attract people. We should eliminate those types of barriers, and there's plenty of other things. But it doesn't mean we should do what we are seeing in a lot of other states, which they're literally just throwing up their hands and saying anyone can come in and teach. That's a problem. Anyone. That is a problem. You don't maintain your top schools in the nation if anyone can just come in and do it. But Sean, also make it clear your background as an educator, beyond being president. Yeah, I'm a high school science teacher for many, many years. And, that's the passion people come in with. But yes, you want to make sure people are coming in who are competent and know it, but also know how to be an educator. Just because you know content doesn't mean you're going to be able to connect with kids or be an effective teacher. So we've got to maintain high standards, but we do need to eliminate barriers. The other piece of this, some people think it's connected, some people don't, but school violence, mass shootings. One of the people I'll be interviewing here at the convention is David Hogg, a survivor from Parkland, horrific Parkland murders, the horrible situation there. David's one of the keynote speakers there, but school violence, shootings, mass murders. First of all, is it overstated in any way? B, is there a connection between that and teachers saying, hey, wait a minute, I'm tapping out? There's definitely a connection when you talk about the social and emotional health of both students and the staff who work in schools.
Sure.
I would say add to that the trauma, yes, from the shootings and the violence and the murders, but add to that the trauma of constantly having a drill where you're told to hide in a corner, where you're told to be really, really quiet, where they don't tell you it's a drill because they can't, right? They've got to have you practice. Someone shaking the door violently to even simulate somebody who's entered the building. You don't know exactly what that is. You don't know if it's real or not real. You do that over and over and over. I mean, the trauma that our students, that our staff are facing, the trauma from, of course, the violence that's actually occurring, it obviously takes a toll. And to say that's our solution, you know, to keep hiding in corners versus let's get some logical, common sense gun control, gun reform packages that we know make sense. It's a shame we aren't getting there where we need to be as soon as
Along those lines, you know, the gun control, it's gun safety, gun control.
Yeah.
It's defined and framed differently by different people. There are some who will argue, let's just arm our teachers. Let's give them an opportunity to protect themselves and their students. You say?
Terrible idea.
Terrible.
Terrible idea. You know, first off, any educator I've talked to does not want to be armed, right? That's not our job, that's not our role. We know professionals who are trained in this, police officers, law enforcement, who do countless hours of training, who recognize the stress of a situation. Even they, in high stress situations, constantly will make an error, human error, right? Will accidentally harm someone else. The worst thing I can think of is a number of weapons, way more than we have now, in a school, sitting where? On a teacher's desk, in their pocket, in a drawer, where, right? And I know what that leads to when you have more weapons around, more guns around with close proximity.
It will not, sorry for interrupting. It will not make it safer for those teachers and those kids?
No, I don't think so. Not at all.
Can you envision yourself as a science teacher with that gun?
No, I'd be terrified. The power of a weapon and to take a life sitting right there, having it there. I mean, it takes away from the learning environment first and foremost. But I would not want that near my students in any way. Let alone the bigger problem, after some period of time, forgetting you really have it in the proximity and the student finding it or getting access to it. It's not a good idea.
Finally, on the issue of school violence, school shootings, you're not willing to accept that it's a part of educational life?
No, not at all. I got to tell you, when I walk the floor here, and was before, and we have service dogs that are here, right?
Yeah.
Emotional support.
And some from Parkland and Uvalde?
Yes, yes, and you talk to the individuals with the animals, and certainly know what the animals themselves and their handlers and others have to go through. But the fact that we're trying to comfort students, more students and more students from these shootings, it's just heartbreaking, and that's not what we have to accept. We can do better.
Sean Spiller is the president of the New Jersey Education Association, the mayor of Montclair, and this is the 2022 NJEA Convention. A lot of interesting and important things going on. The future of our kids, the future of our schools, future of education at stake. Thank you, Mr. President.
Thank you. Thanks so much for having me.
That's great.
Hundreds of thousands of people in New Jersey face hunger.
Now, more than ever.
Together with our 800-plus agency partners.
Now, more than ever.
The Community Food Bank of New Jersey is fighting hunger.
Now, more than ever.
You can help our hungry neighbors by going to cfbnj.org. Join us.
New Jersey is home to the best public schools in the nation, and that didn't happen by accident. It's the result of parents, educators, and communities working together year after year to give our students a world-class education, no matter the challenge. Because parents and educators know that with a shared commitment to our public schools, our children can learn, grow, and thrive. And together, we can keep New Jersey's public schools the best in the nation.
We're now joined by Jeffrey Spivack, who is Director of Financial Planning Operations for Citizens Bank. Good to see you, Jeffrey.
Thanks, Steve. Happy to be here. Thank you for inviting me to come along.
You got Jeffrey, we're doing this program right around Thanksgiving, be seen a little bit later. The economy, the recession, or some form of recession, and financial anxiety. Am I making too much of that, my friend?
No, there's a lot of that floating around right now. And what's more, not only is there a lot of anxiety floating around, questions about inflation, questions about the stock market, questions about coming off the recent midterms, there's a lot of causes for anxiety. And an awful lot of people out there right now aren't 100% sure what to do. And a lot of the prevalent guidance is, don't worry, the market's going to come back. Interest rates are going to come down. To me, that's kind of a facile answer. I would look at it and I would say to them, instead of doing nothing, let's go revisit our financial plan and see if we've taken any damage in this market. See if there isn't any opportunities we can use to exploit what's happening in the market right now and take kind of a proactive control approach as opposed to just waiting for things to improve.
Let's stay on this, because I only refer to myself because I'm representative of a lot of people who go, hey, wait a minute. So I'm not that far away from who knows what retirement, semi-retirement means, who knows. But I would say this to you, as I sit there and look at that. And those who have savings, and hopefully you do, and not everyone does, you sit there and go, okay, well, I'm taking a hit in the market, so I need to make a move now. But then I think to myself, there's a paper loss, and then there's a real loss. And again, for those who are not in the stock market, choose to, or not able to, I don't want to offend anyone, but the difference between a paper loss and a real loss is real. So that's why I go, sit tight, just sit here. But you say that's not a plan.
It's not a plan, Steve. A plan in this case is we go in and we take a look at your cash flow. We make sure that we have adequate emergency savings in case the negative economy impacts on somebody's employment.
And you don't mean in equities, you mean in cash. You're not losing anything there, right?
No, well, no, not at all. I mean, it's about measuring the cash flow, breaking it out, taking a look at the budget and seeing if there's things that could be cut back on to improve on savings. This is a great time. This may be a tough time to be invested in the stock market. It is probably historically going to turn out to be a great time to be investing in the stock market. And being able to break out surplus cash flows, a way to be able to supplement savings, is probably going to do nothing but improve the situation for many investors out there in the marketplace in coming days and months and years. But sitting tight and not doing anything, that is, to me, would be a second decision, not the first decision. The first decision should be, let's revisit our financial plan and see where we stand right now. See if there are any opportunities to be able to improve our situation or take advantage of what's happening now.
Jeffrey, why do you think so many people find it so uncomfortable to talk about money, to talk about finances? And I like to ask one question at a time, frankly, to have an honest discussion about their budget, or don't even have one.
Well, that's many of the people that I talk to on a day-by-day basis. The reality is people are used to working, doing what it is that they do, taking care of the finances. That's a secondary thing. And very often the time that they're most interested is when they hear the stock market hitting new highs, which probably long-term won't benefit them quite as much as when the market's, nearer to lows. I think it's an honest time for people to get together with the people that they trust, competent, qualified advisors who can provide a financial plan to try to determine what is their current situation. Are they off track? And is retirement now bumped out a few years? Are we going to have to take less? When you have clients who wind up in shortfall, we really only have a couple of switches to be able to pull. One is how much we save. Two is how we invest. Three is when we can retire. And four is how much we can take in retirement. So when we look at those goals, whether retirement is 20 years away or 5 years away, or it happened 2 years ago, being able to make decisions around that is what creates the anxiety level.
How do you create a budget? And for people watching, well, yeah, of course I know how to create a budget, but I'm not sure most people do. What are some of the key steps in creating a family or personal budget?
Well, it usually starts with listing out the major expenses. Let's take a look at the major expenses, break them into categories, make sure that we can see which ones cost us more, particularly in a higher interest rate environment. In a higher interest rate environment, an existing loan probably costs quite a bit less than, for example, credit cards. Coming up with a plan to be able to reduce it so that, how much people are having to pay out because interest rates are high at present isn't draining their finances as they're going on. Remember that inflation doesn't just impact on groceries and gasoline and purchase of major items. It also impacts on money and, particularly in debt. And that can be a very serious problem, for somebody that's got the wrong mixture of debt.
Jeffrey, let me try this. And P.S. Citizens has taken over Investors, if I'm not mistaken. Investors has been a longtime underwriter of ours. Citizens is taken over, correct, for Investors?
That's correct, yes.
I get that right. So this is what I'm curious about. So younger people, I don't know, teens, younger, whatever, is it harder to talk to kids about financial literacy is a bad word, just basic money issues, A, and B, why is it so important?
Well, when you talk to people that are younger, the problem is the timeline. They look at it and they go, yeah, I don't know if I'm ever going to retire. Or if I'm going to retire, it's 30 years from now. Why am I worried about it today? When the reality is every dollar that you put away now when they're that young is probably going to be could be $6, $7, $8 when retirement actually comes. It's going to have a lot more bang than a dollar they put away, say, 20 years from now. I like the term financial literacy, Steve. I think that financial literacy is very much something that should be taught. I learned it at my father's, sitting next to my father as he explained it to me. But then I took that and I went and I studied economics and I studied finance, and that became my life's work. I don't suspect that's going to be for everybody or most people, but being able to be literate about your finances, that's an important lesson that everybody should learn. And it's never too late. All you need to do is find the right advisor, the person that's qualified to be able to give you good advice, and sit down and create a financial plan. Part of it's about the cash flow and the budget. Part of it's about liability management. And a good piece of it is probably about investing and investment management. Are we invested in the right place? Did things shift in the marketplace? Should we be making moves to try to bring it back into alignment with our risk objective?
But Jeffrey, I have one more quick one on this before I let you go.
Yeah.
Isn't it difficult to plan when so many things, COVID being the most obvious in the last several years, when so many things are unpredictable, including, am I going to even have this job? Is my company going to shut down? Are they going to lay people off? Isn't it very difficult to plan financially in such an environment that's so unpredictable?
Well, of course, but the thing about planning is whatever your situation is, financially, economically, in terms of job stability, planning brings more certainty, not less. And the actual creation of the financial plan is not a bullet event. It's not a one-time thing you fire and it's good to go. And I did a plan 5 years ago, so I'm all set. It's about revisiting. It's about coming back to it. The majority of most financial plans build very much into the type of market volatility that we've seen. They look at it. They run, for example, a Monte Carlo analysis to say, what happens if the stock market does drop 20% next year? How often am I not going to be able to successfully retire, on the basis of that? And, the plans that we do ourselves take that very much into account. So do most of my colleagues and our competitors.
Jeffrey Spivack, I want to thank you so much for joining us to talk about money issues, finance. It matters a great deal. Jeffrey, thank you. All the best.
You bet. Thank you very much, Steve. Take care.
You got it. Thank you so much for watching. I'm Steve Adubato. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Delta Dental of New Jersey, the Russell Berry Foundation, the Adler Aphasia Center, Robert Wood Johnson Foundation, Community Food Bank of New Jersey, Summit Health, the North Ward Center, New Jersey's Clean Energy Program, and by Johnson & Johnson. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly.
Hundreds of thousands of people in New Jersey face hunger.
Now, more than ever.
Together with our 800-plus agency partners.
Now, more than ever.
The Community Food Bank of New Jersey is fighting hunger.
Now, more than ever.
You can help our hungry neighbors by going to cfbnj.org. Join us.
New Jersey is home to the best public schools in the nation, and that didn't happen by accident. It's the result of parents, educators, and communities working together year after year to give our students a world-class education, no matter the challenge. Because parents and educators know that with a shared commitment to our public schools, our children can learn, grow, and thrive. And together, we can keep New Jersey's public schools the best in the nation.